Hi, my name is Dr. Valerie Libby, and I am an OBGYN, and I have a specialty training in fertility. Today we're going to be talking about the egg freezing process. So egg freezing is basically the process where you undergo 2 weeks of injection medications to try to grow as many eggs as possible in your ovaries. You do have to come in for monitoring, ultrasound, and blood work during those 2 weeks about every other day. And that culminates with a final egg retrieval where you come into our office, we put you to sleep under anesthesia, and we try to get as many eggs out as we possibly can. So these are eggs that we've recruited to grow over the last 2 weeks that would normally have just died this month. It's not like you go into menopause any sooner or you lose eggs that you would have needed later on in life. We're just recruiting them to grow. We're taking them out, we're putting them in our embryology laboratory, and we're freezing them for you in liquid nitrogen where they will remain forever until you're ready to use them later on in life when you've met the right partner or you're ready to conceive using donor sperm. And we try to do this at a younger age so that when we do get older and our eggs aren't as good quality and our quantity of eggs isn't as good, we will be able to utilize the eggs from when we were younger to get pregnant. So how long does egg freezing take? That's a great question. So typically egg freezing takes about 2 weeks, and those 2 weeks are the 2 weeks of stimulation. So where you come into our office and every other day we do ultrasound and blood work, and it ends with the egg retrieval. Now, before you start the 2 weeks of injections, the doctor may decide to put you on some sort of priming medication that may make your ovaries either more responsive to the medications or may help decrease your risk of ovarian hyperstimulation, and also helps synchronize the growth of the cohort of eggs so that they all respond at the same time when you start your injections. So what are the steps of an egg freezing cycle? So, a typical day in the life of an egg freezing patient usually starts with, they call their office with the first day of their period, and the nurse will say, okay, let's schedule a baseline ultrasound, which is their first ultrasound they'll have of the cycle. And they'll come into the office, they'll get, the typical transvaginal ultrasound and blood work. They'll do that in the morning, probably before work starts. They'll go to work, they'll do their normal daily tasks. And then in the afternoon, they'll get a phone call from the nurse or the physician, and they'll say, okay, you are ready. The doctor has reviewed your ultrasound and blood work, and you are ready to start your medications tonight. The nurse will review the medications with you and exactly what you're supposed to take. And she'll also schedule a follow-up visit when you come in again in a few days to get another ultrasound and blood work. So that evening, usually between the hours of 6 and 10 p.m. at night, every night during these 2 weeks, you will prepare the medications and then simply grab your lower belly and inject the medicine that evening. Give yourself about 30 minutes to really get the medications organized, just because it can be a little bit complicated. And then, injections very quick, you barely feel it, honestly. And then next morning, you'll, go about your normal day. That evening, you'll do the injections. And then probably the following day or the next day, you'll come in for your next ultrasound and blood work to kind of see where, if your follicles have grown and if the estrogen level has been higher and higher, like we want it to do. So what are the fertility medications doing in your body? Every month in a normal woman, our brain will release a signal to our ovaries to grow an egg inside of a follicle. The signal from our brain is called follicle stimulating hormone, or FSH. So that tells the ovaries with the follicles inside to grow one lucky follicle that month, which gets bigger and bigger and bigger. And after 2 weeks, your follicle's so big that your brain will send one extra signal to just boost or trigger ovulation. And then you'll ovulate your egg about 36, 40 hours later, okay? So what the injections do when you're doing IVF or egg freezing stimulation is that the injections are the exact same hormone that your brain normally releases to grow your egg every month, the FSH hormone, follicle stimulating hormone. But it's at a much higher dose than your brain normally releases. So instead of just one egg growing, its goal is trying to grow as many eggs as we possibly can that month. And those medications will stimulate the eggs to get bigger and bigger and bigger. Sometimes we'll add in a third medication, either from the beginning or we'll add it in later on in your cycle. If we add it in later on in your cycle, that is typically called an antagonist medication, where basically it allows you to grow the follicles without releasing the egg. So it stops you from ovulating before we want you to ovulate. So what day do your medications typically start? And this does vary a little bit between clinics and between physicians, even sometimes within the clinic. Again, sometimes the doctor will decide to put you on some injections or some pills prior to your stimulation starting, prior to the actual, injections that are going to grow the eggs, where you have to come in every other day. But traditionally, the stimulation injections, where you have to come into the office every other day during that 2-week period, those typically start right after that baseline ultrasound. Usually that evening, you'll start your injections. On average, how many shots will you have to do per day? Again, that also varies, but typically we start with 2 injections a night. And then a little bit later on in your cycle, after like 5 to 7 days, we'll maybe add in a 3rd injection. How will the medications impact your mood? That's a great question, and always a difficult question to answer. Everybody's different. Some people are more, likely to have premenstrual symptoms when you don't feel as, good when you are, around your period. Some people don't get that at all. And it's not always the case that the people that get PMS also, have poor mood responses to IVF. Essentially, everybody is different. So, I did egg freezing 5 times. My mood, wasn't really that different throughout the process. I didn't notice a difference. I definitely was a little more sensitive, I would say, and like cried a little bit easier to movies and stuff like that. And my skin was more sensitive. But with that being said, some women are more sensitive and more responsive to changes, because during these 2 weeks, your estrogen level is getting higher than it normally gets every month. So, it's a temporary thing. But just know we really won't know your response. But I've never had a patient call and say, my mood is not good, I need to cancel this. I've never had a patient say that, really they don't really complain about that until they look back on the cycle and they're like, yeah, it was a little bitchy or something. But it's not something that I hear often, and everybody is different. Why would you need your medications increased or decreased during a cycle? So the reason why we bring you back every other day while you're injecting yourself with medicines is so the doctors can monitor your response. We are balancing the risks of egg freezing. So one of the biggest risks of egg freezing is ovarian hyperstimulation syndrome, where you over-respond to the medications. It can be very dangerous, and we do not want that to happen to anybody. So if you come in and we see that you may be responding a little bit too well, a little bit too much, then we may decrease your medications. On the other hand, another risk of egg freezing is something called cycle cancellation, where you don't respond as well as we want you to respond. And if you're not responding that well, often the doctor will call you and will say, look, patient, you're not responding as well as we think you could respond. I don't want you to have to undergo an egg retrieval, which is very expensive, the most expensive part of the process. And also it's the most, one of the most dangerous parts, just because you're going under IV and you're going under anesthesia and we're putting a needle inside. I'd rather just cancel the cycle and have you start over again next month with a new medication protocol so that we can really maximize your response. So that's called cycle cancellation. So if a patient, is under responding or not responding as well as we think they could respond, then when we bring them back, we may call them and say, I think you should increase the dose of medication tonight. And then we'll hopefully elicit a better response. At what point will the retrieval be? So typically it takes about, anywhere between 9 to 14 days of injecting yourself every night with these medications until your ovaries, your follicles are very large and the eggs inside of them will be mature enough to be useful eggs. And we'll be able to tell that based on the size of the follicles and your level of estrogen. And once you have achieved that final day of stimulation, and we've known that, from your ultrasound and blood work, then we'll call you and we'll say, okay, you're gonna be ready to take your trigger injection this evening. That's the last injection that you'll probably have to take before your egg retrieval, which usually occurs 2 days later in the morning. That injection is the most important injection to take at a specific time. All the other injections during the cycle, we usually say between 6 and 10 p.m. and it doesn't have to be the exact same time every night. You have a lot of wiggle room there. But this injection, the trigger injection, is very, very important to take at the specific time that the nurse tells you to take. So you're definitely gonna wanna make sure about an hour before you're supposed to take the injection that all of your medications are ready to go. But I highly recommend when the nurse calls you, you make sure you have those medicines, because the worst thing that could happen is you don't have the correct medicines in your home that you will need that evening. So then that evening, you'll inject the correct medications for your trigger injection, which is that final injection again. And then usually you may come back the next day for just blood work. Depending on the type of injection that you take for your trigger, you may have to take another injection that next evening. And the following day, so 2 days after that initial trigger injection, in the morning, you'll come in for your egg retrieval. So the evening before, you'll have nothing to eat or drink after midnight, and then you'll come in the morning, and you'll need to bring, someone with you, either your mom or your boyfriend or a friend, to drive you home, because you'll typically have anesthesia. Is the egg retrieval painful? Every time I've had an egg retrieval and I've seen an egg retrieval, the patient is completely asleep under IV anesthesia. So they don't remember anything, they don't feel anything. So no, the egg retrieval is not painful at all. You cannot feel a single thing. What is the process that occurs the day of your egg retrieval? You'll have come in the morning of your egg retrieval, usually about 30 minutes to an hour before your egg retrieval. You'll have had nothing to eat or drink the evening before, after midnight, prior to your retrieval. You'll come in, you'll be greeted by the staff. We'll get you changed into a gown, and you will, just relax in a little hospital chair or hospital bed. Usually the anesthetist will come in, the nurse will come in, introduce themselves. They may start an IV. Usually the doctor will come in that's going to be performing your procedure and introduce themselves, review, what your plan is to freeze your eggs and what they anticipate will happen during the retrieval. And then essentially they'll, roll you into or walk you into the operating room, and you will lay down on a table. But at this point, you'll probably not remember anything, because usually they give you a medicine where you don't really remember what happened before, but you'll lay down on a table, they'll put your legs up in stirrups, and you'll go to sleep. Once you're asleep, the physician will make sure you're fully draped and cleaned, and they'll open up the door or the little window to the embryology lab, which is right next door, connected typically to the egg retrieval room. This is all occurring, again, while you're asleep, and then they'll put an ultrasound probe in the vagina, just like you have, during your monitoring, but this time it will be completely sterile. That ultrasound will also have a tiny little needle at the end. So using the ultrasound guidance, they'll place the ultrasound probe, looking at the follicles and taking the needle, which will go directly into each of the follicles, and they can actually see the follicles starting to collapse when the needle is inside, because the needle is actually hollow and it's connected to suction tubing. And so we suction out the fluid inside each of the follicles, and in that fluid, there should be an egg. So we take that fluid and it collects into a little tube, and we give it to our embryologist, and the embryologist pours out the liquid into a little petri dish in the lab, looks at it under a microscope, and sees your little eggs. They, take away the cells around the egg, and then they prepare the egg for freezing. So obviously the doctor does that as many times as possible to get as many eggs as possible. And while they're doing this, the embryologist will tell them, hey, 1, 2, 3, 4, and they're counting the number of eggs that they're seeing. So that helps the doctor know, okay, I'm doing a good job, I'm not doing, that kind of thing. And then once they've completed, all the eggs, they've collapsed all the eggs and suctioned out all the fluid, the doctor will, just inspect the area in the pelvis to make sure that there weren't any issues and they didn't run into, there's no, bleeding in the pelvis. and then they'll remove the ultrasound probe. They'll, usually just inspect and make sure that, you don't have any bleeding in your vagina. They'll clean you off, and they'll place you back, into, your comfortable position, and then they'll roll you onto a bed, and then you'll go into the recovery room where you will wake up, usually with a nurse and your family member, or friend or boyfriend, whoever came with you. How long does the bloating last during this process? So great question. So the bloating, it usually starts during your egg, stimulation. So when you're injecting yourself with all these medicines, your ovaries are getting much larger. So it's normal to feel bloated. You start feeling a little bloated, a little uncomfortable, and then you'll have your egg retrieval. That will probably be the maximum amount of bloating. Sometimes you have a little bit more bloating after your retrieval. But typically it always resolves with your next period. So the period following the egg retrieval, which typically is like 1 to 2 weeks after your egg retrieval. So that's typically what it is. If you have very rare, response to the medications called hyperstimulation, then bloating may last longer. But at the most, it will usually always resolve with your next period. So can you go to work the day following your egg retrieval? Yes, you definitely can. Of course, there could have been a complication. I've never had someone be in a situation where they can't return to work the following day. So, you usually that, afternoon after your egg retrieval, you probably want to relax and definitely take it off of work because you have had anesthesia that morning. But by the next day, you should be fully recovered and ready to go to work. Of course, you may still be bloated until your next period comes, but you can go back to work the following day. When do you know how many eggs you may get from a cycle? So that's a really tough question. You definitely don't know that when you are told your follicle count. If the doctor is able to see, on your first ultrasound that they ever meet you with, they're able to see like 15 eggs on your antral follicle count, that does not mean you're going to get 15 eggs from your egg retrieval. You don't really know how many eggs you're going to get until your egg retrieval happens. But typically, when you are undergoing your stimulation, the doctor knows that you're ready for your trigger shot, your last injection prior to your retrieval. They'll know that when you have, most of your follicles are above about 14 millimeters. Usually the follicles above 14 to 15 millimeters should have an egg inside and should produce an egg. So typically, those follicles, when you go in during your egg retrieval, you should be able to have an egg. There is a chance that you go in during your egg retrieval and you try to, get an egg from a follicle and there's no egg in that follicle. There's a lot of different reasons why that can happen. Sometimes you've ovulated the egg a little bit earlier, or sometimes it gets stuck to the wall. Typically there is an egg somewhere, it just wasn't able to be retrieved. It either ovulated or was stuck to the wall. Very rarely does nobody have an egg inside their follicles. Very, very rarely. But the doctor, may tell you how many eggs they're seeing. You may be able to deduce that from your ultrasounds. If you do hear a number, what I usually say is the night before your egg retrieval, close your eyes and think to yourself, what number are you not going to allow yourself to be upset with tomorrow when you hear how many eggs you got? And I always say to shoot low. So if they're seeing, 15 eggs above 14 millimeters, I would say, okay, I am not allowed to be upset if I get 8 or more eggs. And so I think that's like, a reasonable number, so that if you get, 9 eggs, you can't be upset. I mean, it's still a good number. So I would say, you can guess, but you really don't know until you undergo the egg retrieval. So at what point are those eggs frozen? So you come in for your egg retrieval, the doctor performs the retrieval of the eggs and puts them in a dish in the lab. And then sometime that day, the embryologist will, prepare the eggs in a certain process for rapid vitrification or rapid freezing, where they essentially plunge the eggs and freeze them in liquid nitrogen, where they will remain. How long can eggs stay frozen? That's a great question. So, egg freezing hasn't been around that long. 2010 or so is when, technology started increasing, the popularity started increasing, and 2012 is when ASRM, they said that egg freezing was no longer considered experimental. So we don't have like super long-term data on egg freezing, but it's thought that eggs should be able to last, an indefinite amount of time. There are some new studies coming out looking at, eggs and embryos and, the shelf life. And, some say like over, 10 to 20 years, the quality may decrease a little bit, but I haven't ever seen that. And there's no large studies that have actually shown that or repeatedly shown that. So I would say at this point, indefinitely. Does egg freezing affect future fertility? The answer is no. So again, these are eggs that have been recruited to grow that would normally have just died that month. So we don't, decrease your fertility by making you go into menopause any sooner or taking out eggs that you need later on in life. So no, it does not decrease your fertility. So on average, what percentage of eggs would you expect to survive the thaw? So typically, with eggs, it again depends on the clinic that you go to and their expertise in the thawing and freezing process. But typically about 90% of your eggs will survive the thaw. And then when you go to fertilize the eggs, not all of them are going to fertilize normally. So usually about, 80 to 90 again will fertilize normally. That means that becomes an embryo. And then you have to grow the embryos out in the lab for 5 days to become a high quality embryo. And depending on your age, usually between 25 to 35% of them will grow out to a good quality embryo called a blastocyst. And then even if we biopsy the embryo to see if it's normal or not, which we would recommend typically if you're over 35 when you're doing it, when you actually froze your eggs. If you do decide to biopsy the embryo, depending on your age, you'll have a different chance of the embryos being normal or not normal. Obviously, the older you are, the higher chance that more of them will be abnormal. But if you're 35, about 50% will be normal, okay? So then when you go to biopsy the embryo, let's say 50% are normal, and even if I put back a normal embryo into a woman, there's still a 35% chance of either it non-implanting or resulting in a miscarriage. How many times can you do egg freezing? Often clinics, may set limits. They may not. Usually it's a discussion between yourself and your physician, maybe your insurance coverage or your, ability to, pay for the retrieval each time. But usually after about 6 cycles, that's when, at least if you're like an egg donor, that's when we would not allow you to donate more than that. But if it's your own eggs and you're just freezing them, I would also have a really serious discussion with the patient about, the utility and futility of proceeding with more egg retrievals, just because it's, it's expensive. You have to go under anesthesia, multiple times. So, yeah. So can patients do anything to improve their egg quality or quantity? There isn't any proven, thing that unfortunately that can improve your egg quality and quantity. I would say, typically if you're on chronic birth control pills, getting off of those for like a month or 2 or 3 before your stimulation would be a good idea. And, just being healthy, avoiding, drugs and alcohol and cigarettes and smoke as much as possible prior to the retrieval. Typically, the 2 to 3 months prior to retrieval are, those are the eggs that are going to be waking up from dormancy to be recruited to grow. So that's the most important time to be healthy. And then some people recommend taking supplements like DHEA and CoQ10 prior to your egg retrieval that may help improve egg quality, but honestly, there isn't much, unfortunately, we can do to improve egg quality. Is there anything that a woman should change with their diet or the food that they're eating prior to an egg freezing cycle? And the answer is no. Just be healthy. I would say, again, these are the eggs that you are going to make your future children with probably. So just be as healthy as you can. I also do recommend taking prenatal vitamins for a couple months before your egg freezing cycle. You don't have to. But typically if you're trying to conceive, we would tell you to do that. So I usually tell my patients to do that, but there's no, specific foods to eat or to not eat that, will impact your cycle. Should you drink alcohol or not during your egg stimulation? I usually recommend not to drink alcohol during your stimulation. Really the rationale is, again, these are the eggs that you're going to be producing your children. And so we don't know, if that could potentially affect your egg quality, and then could also affect your response to the medication. So that's typically what we would recommend. Are there any do's and don'ts during an egg freezing cycle? So again, I would avoid alcohol and drugs, and I would try to be as fit as possible, like prior to the retrieval and prior to the stimulation. During your stimulation though, we generally say no sex and no exercise. During your stimulation, at least for the week before, definitely, and the week after until your next period comes, just because for the risk of ovarian torsion. So your ovaries do get larger when you're injecting yourself with these medications. And so they are at risk for turning on themselves or torsing, which can be very dangerous. And that the risk is increased if you're jumping up and down and doing exercises and having sex. So definitely we recommend abstaining from sex and exercise during that time. Just keep yourself healthy as possible. Make sure you have all your medications prepared far before your stimulation starts. And during your stimulation, make sure you continue to keep track of your medications, and if you need to order more, you've ordered it well in advance. Make sure you have all of the instructions ready to go. You've watched your videos. If you have any travel planned during your stimulation, definitely let your nursing team know that, so that they can adjust your calendar accordingly. That's pretty much my do's and don'ts. On average, how much does egg freezing cost if you have to pay out of pocket, if you don't have insurance? Egg freezing cost does vary, by clinic. Often that's correlated with the quality of the clinic. So I definitely would say to make sure you choose your clinic wisely per cycle. So that includes the cost of all of your ultrasounds and blood work during your stimulation cycle, as well as the egg retrieval and the initial vitrification of the eggs. That is about, $8,000. In addition to that cost, you have to know that you're typically on top of that paying for your medicines. And medicines can range anywhere between $3,000 and $5,000 a cycle. And you pay that to the pharmacy. So that's an additional cost that you have to pay. And then you're also paying for storage of the eggs. So storage of your eggs, it depends on the clinic. It's about $500 a year, typically, in most clinics. There is financing available. It depends on the clinic I'm sure that you go to. They'll give you recommendations on different, financing options or companies that can help you finance your cycle. So if someone is interested in egg freezing, the most important thing to do is contact a fertility doctor and find out your ovarian reserve. So really it's how well you'll respond to the egg freezing medications. Do that as soon as you possibly can. Even if you're just not certain and you just want to inquire, it's a really good idea to do that. And they'll check, some blood tests, and they'll do an ultrasound, and that will tell you sort of where you fall on the spectrum of your ovarian reserve or your egg count, and also how well you'll respond to the medications and how many eggs they anticipate you getting from an egg retrieval cycle. And then they'll go on to tell you, what is the chance of, having a live baby from, this many frozen eggs or one retrieval, that kind of thing. The other important thing to do if you're considering it is to find out if you do have any insurance coverage. And if you go to a fertility clinic, usually they will have a financial counselor that will see you or, review your insurance prior to you meeting with a doctor to let you know if you do have any insurance coverage. And I will say that many people don't know they have insurance coverage until they come to see us. So definitely find out, or come to see us and we'll tell you if you do have any coverage for egg freezing.